Alright, you guys, so I'm just going to tell you guys real quick how I highlight through my book and how I read through my book, because that's one of the main questions that I get asked from you guys, and I want to be sure that I'm telling you guys accurate information. So I already highlighted, but I'm just going to explain to you what I did and how I did it. Okay, so first and foremost, when you get notes for your honestly, when you're in nursing school, your book is like everything. Your book is like what water is to us. We need water, and you need your book. Your book should be your number one main place to go to for studying in nursing school. If you go through your book, you should definitely not have a hard time doing decent on tests. It's no reason, because you'll see a lot of times with instructors, while they're teaching the class, they'll literally have their textbook just like us right in front of them. They'll literally have notes in their textbook, highlights just like we would from their book, points that they want you to touch on in their book. When they make your notes, like my notes are right in front of me, it comes straight from the book. So if you use your book, it's no reason that you should fail a test, honestly, because everything is literally right here for you. They literally will pull stuff and make it into a question straight from the book. There's so many times that I have seen a question that literally is a sentence from my book, and I'm like, wow, I read that, I know the answer. So that's something to definitely make sure of, that when you start nursing school, that your book is your best friend. Do not think you can do without it or just use your notes, and I will explain why in a second, because it will not work. So for example, here's my notes. I like to keep my notes while I'm highlighting, because I like to make sure that I'm touching on everything that my notes are touching on, because usually your notes are what your instructor thinks are important. But usually your notes align right with your book. But anything extra that you might have wrote on your notes in class, anything that they might have said don't worry about, you want to make sure that you're connecting that with your book, so that you can make sure you're highlighting the correct stuff or not highlighting stuff that you don't need to. So with that being said, with notes, usually in nursing school, notes are very vague. There's a lot of material. So a lot of times they'll just have a word and that's it. Like, we're learning about blood disorders and anemia and sickle cell. So literally we'll have what sickle cell is, and that's it. It won't have any type of extra stuff that I need to know, because again, if you have a huge chapter, 40, 50 slides, you don't have time to crunch all that on there. They just want you to know this is what sickle cell is. You need to read up on it. So this is why, again, I say you need to use your book, because a lot of times in nursing school, your notes are going to not be detailed. It's just going to be basic stuff that they say, okay, you just need to know what this is and follow up on that. So I'll have my notes, and I'll say, okay, we are learning about sickle cell. So I'll go into my book, and I'll say, all right, I'll flip through my page. I'm like, all right, where's sickle cell at? So I'll find it. And this is my medical nursing surgical book that I'm using. And a lot of people use the same book, but some people are different. But this is my book. So I'll go and I'm like, okay, I'll find sickle cell. So every time in this book, when it has a disease process, it always has the patho. You only need to know probably the first 2 or 3 sentences of patho. You do not need to know the nitty gritty. When you get into these books, you'll see that patho takes up, this is literally all patho. It takes up a lot of stuff. You don't need to know that, because we're not doctors. We're not going to school to be doctors. Usually doctors, you'll see they get very into pathophysiology about things. As a nurse, you just need to know what a disease process is and why it occurs. So anytime you see, okay, sickle cell disease, or say diabetes, or say pulmonary embolism, whatever you are learning about in class, you just need to know what it is, so the definition of it and why it occurs. Once you highlight that in your book, and again, that's usually the first sentence of what it is, and like a sentence or 2 later, it tells you why it happens to people. Once you highlight that, then you can move on. So then after that, usually in your book, and I'm pretty sure every nursing book's the same way, it breaks down assessment. As a nurse, you have to always assess a patient when they first come in. That means ask them questions, getting history. Then you always want to get signs and symptoms. You always want to know what signs and symptoms, what clinical manifestations are specific to this certain disease process. After that, you always want to know any type of labs that have to be drawn specific to this disease process. Then you want to know, okay, any type of interventions that as a nurse you should do specific for this disease process, and any nursing diagnosis that will be specific for this person. After that, you always want to go into teaching what you would teach this patient about the disease process. Because, of course, if a patient comes into the hospital with sickle cell, you would try to get them better, and then before they discharge, you would want to teach them about certain things that they can do at home, so maybe they can avoid coming to the hospital, or maybe that they can not be as bad, or whatever the case may be. Of course, sickle cell is different. It's very intense, so they're going to be in and out the hospital, but you guys get the gist. So, again, I'm reading through my book. I'm like, all right, this looks like jibber jabber. Like, this looks like a whole bunch of stuff I don't need to know. What, again, when you're highlighting, you have to think as a nurse. What would I assess? Okay, someone with sickle cell, what would I look for in someone who has sickle? What would I ask someone who has sickle cell? Oh, that's right here. So I'll highlight, okay, this is stuff I would ask. This is stuff I would look for if someone who has sickle cell came in my unit. Then you're like, okay, what sign and symptoms does someone have who has sickle cell? And usually, okay, that's in your book right here, physical assessment and clinical manifestations. It will literally break down specific systems and what it does. For example, anytime you see any type of slanted word, it usually is important. Any type of slanted, bolded, red, different color, like smacking your face type of stuff, you want to highlight it. So for this example, it's telling me signs and symptoms. It's telling me, okay, cardiovascular signs and symptoms of someone with sickle cell is this. Someone with sickle cell only shows this. Someone with sickle cell only shows this with their skin. Anytime it's something specific to that disease process, you want to highlight it. Then, okay, you're like, all right, I got all the signs and symptoms that are specific to sickle cell. Now you need to know, okay, what assessments will I, like labs and things and tests will I do for this person? So any type of labs that, again, are specific to that, which is always lined up in your book right after the disease process is mentioned, you want to highlight that. Now, do not highlight everything word for word. You just need to know what labs, you want to know normal value, what's abnormal, and what will show with someone who has this disease process. So if with sickle cell, you have to draw up a lab for HCT, you need to know, okay, what's normal and what would be abnormal and what someone with sickle cell will show. A lot of times in class, they'll have you like a table with labs that they say, okay, you need to remember this table, or it'll just be lined up in the book. But any type of lab values that go with a specific disease process, you need to know those numbers and highlight that in your book as well. So you'll keep going. Then you'll get into interventions. You need to know interventions. That's a big thing. Teachers love to ask questions about interventions, what you would do. So you want to highlight any type of interventions for a certain disease process. You want to highlight that. Any type of thing that's saying to preventing something, anything that you'll teach, any intervention, you want to highlight those. Now, I'm not saying highlight this whole page. I'm just saying highlight the main points. So again, anything that's bolded, slanted, anything that's, they're saying this is definitely important. This is something that you do first. This is the priority. You want to highlight that. And then that's pretty much how you go through your book. And you just do the same thing. Usually any bolded words, different color, you want to highlight those. I like to highlight pictures sometimes too, so I can kind of see, because sometimes teachers will take a picture of a disease process and put it on your test and say, a patient comes up with this, what would you expect them to have? I have seen it, and those are easy point questions if you just look at the pictures. But yeah, that's pretty much all that I do. So after I do that and I kind of line it with my notes and I kind of highlight bolded words or anything that I think is important, then I will go back and I will read through the chapter of what I highlighted. And anything that I miss, so say I'm reading, I'm like, okay, I highlighted this, and I kind of like start reading a little bit more. I'm like, oh, that looks important. I'll highlight it again. So, and since you kind of are reading the whole entire chapter, but you're not sitting and reading it at one time, because you're only highlighting stuff that's in your notes and stuff that looks important. So if you read your chapter a couple times, by the time you say you only read this chapter an hour a couple times a day, not a couple times, but say you study 5 days a week, and you read, you're like, okay, today I'm going to read through my chapter and everything I highlighted. You're going to find stuff that you think is important. You're going to highlight it. So then say you read again tomorrow. You're going to go read through it, and you might find something else important and highlight it. So you're kind of reading the whole chapter, but you don't have to sit there and suffer reading, a whole chapter one day. If you break it up like this and you highlight what you see is important or what's in your notes, by the time you study your chapter a couple of times and highlight it a couple of times, you have already gone through the whole entire chapter and don't even realize it, because you're just doing bits and pieces individually, if that makes sense. So that's pretty much all that I do. And again, that's all I do is just go through my notes and that. But if you just follow that rule of thumb, saying, how I broke it into assessment, interventions, sign and symptoms, labs, teaching, I'm telling you guys, that's like a no-fail way to study. So definitely think of that all the time, every time you're studying through your book. I hope that these videos help. I've recorded this video so many times because I want it to make sense. But hopefully that made sense for you guys, and I hope that this video helps you guys. And if you have any more questions, please feel free to tell me or ask me. I know a lot of you guys follow me on Instagram. If you haven't, please follow me, DM me, comment. I am so for helping you guys as best as I can, because I know this is hard, it's stressful, it's difficult to get into a nursing thinking mindset. Trust me, I struggle with it all the time. But once you start to think like that while you're reading your book, you will start to be able to go through a chapter with no problem, because you already know what to look for, what's important, what's not important. So yes, I hope that this video helped you guys. And thank you guys so much for watching. And I will see you guys in my next nursing video. Alright, you guys. Bye.